And it's on this note that I want to invite Dr. Paula Kemi Anjorin and the DataDENT team that's around to take us through the presentation, which is meant to be 45 minutes, but it will be like 25 minutes, and we'll take a few questions before we jump to our tea break. Thank you very much. Let's appreciate Paula Kemi. Can we have the slides, please?
At the front of the, okay. Thank you. Good morning, madam. Good morning, everyone. Yes. While the slide is going or coming up, okay. So today I will be speaking about learning from multisectoral nutrition data assessment. You want to see my nice, beautiful face? Okay, good. I won't audit. All right. Thank you very much. So, learning from multisectoral nutrition data assessment. Yeah. Yes, we did. Something health plus something. But you can check with Kendra. The ICT. Okay. So I'll keep speaking about it while the slide comes up, then we can also backtrack just to show the slide. Okay, so the background to the assessment, we always like to start from where it started from. It started from the October 2022 National Nutrition Data and Result Conference, where there was a consensus for Nigeria to have a multisectoral nutrition data framework and possibly also a national nutrition data alliance to drive nutrition data coordination in Nigeria. From that conference, it was clear that a lot of nutrition activities were going on because it was presentation from even private sector, even sugar tax, and all of that. So many people brought out data, but we found out that there were lots of challenges around poor data sharing, quality of the data itself, and many other challenges. So it was based on that, and also building on the success of working with the Federal Ministry of Health and Social Welfare at that time, where DataDENT worked closely with the health sector to develop the health sector recommendation for nutrition indicators collected nationally in Nigeria. So, and that piece of work, of course, was formative assessment leading to the document, then led to the demand that, can we do something similar for all the other sectors that are contributing to nutrition in Nigeria. So that led us to the multi-sector nutrition data assessment, which we had conducted with the 14 plus MDAs that are contributing to nutrition in Nigeria, from water resources, from agriculture, social protection, education, and all of the sectors that are contributing to nutrition. So the assessment covers both policy review and interviews with stakeholders whom we have categorized as data users and data producers, because a lot of times some people are involved in generating data, others are also involved in making decisions based on the data that is being generated. So for us to be able to develop a framework, we needed to understand what policies guide nutrition within each of these sectors that are contributing to nutrition. We know that the health sector have its own nutrition-based strategy, the NSPAN. The agri-sector also have the agri-sector food security and nutrition strategy. So the other sectors, they don't have their how do you say, their own specific strategy, but they do have policies that guide their action. So we needed to look at all of the document they refer to when they are coming up with the development of their nutrition plans in the sectors. So we reviewed many of these policies. We also, like I mentioned, spoke with stakeholders at the federal level. Also, typically when we want to do things, because we know implementation happens at the subnational level, so we often do at least 2 states, one northern state and a southern state, a lot of time to just understand the actual context of what types of activities being done, how do data flow within sector and also up to the federal level. So to do that, we had put in place like 6 criteria, which led us to selection of Kebbi State for the north and Oyo State for the south. And we did also work through the State Committee on Food and Nutrition to conduct this assessment with the relevant departments and agencies that are contributing to nutrition. So like I mentioned, because we have done a pretty advanced work for the phase 1 of DataDENT in the health sector, we didn't quite focus a lot on the health sector because we've pretty compiled the indicators. So for this phase, our focus for that was just to try to track the implementation of this health sector recommendation to see how our things change, because we are talking about 2022. By 2022, MMS intervention was not fully developed. By now, I mean, there are lots of analyses that have gone, and now there was a recommendation in this health sector document that specified the inclusion of MMS into DHIS2. So we've had partners and working with governments to work, with the DHIS team to include some of those. I think is MMS counseling, number of women also who received, and all of that, like 3 indicators on that, which I will speak to. So our focus for this round is to track the status of that and also bring on other things like food. Within the period also, the health sector had released a food safety policy, which also has implications. So pretty much what we are doing for the health sector is to just track the updates on what has been done in terms of administrative data, that's the NHMIS, and also national surveys in Nigeria. So I mentioned at the global level, based on the recommendation, the integration of MMS coverage indicator in surveys like MIX, that's multiple indicator cluster surveys, and many DHS that has been DataDENT at work at the global level to develop new guidance for DHS survey questions to help distinguish between the IFAR and MMS coverage and adherence. Also, there were the mix. Also, there was recommendation to include mycin counseling, IFA, MMS, vitamin supplementation, deworming, and the affairs into it. And that is being, I think, mix is, what's the updates? I mean, we are working closely with UNICEF also and other stakeholders on to ensure the implementation of that. We also have during this period also the National Food Consumption and Micronutrient Survey released, and some of the recommendation in the document includes to use the data analysis to inform food-based dietary guideline and other policy guidelines. We also heard that that's also underway within the ministry to develop the food-based dietary guidelines. So those are how some of the recommendations that already exist in the health sector one works out. In terms of the DHS data updates, there's now like a full rollout of the 3 new indicators that has been developed and tested. So like I mentioned, there's number of mothers counseled on MMS during antenatal care clinics, number of pregnant women provided with MMS or folic acid, and number of children 6 to 23 months provided with SQLNS during GMP. We even heard this morning also that now 35 states have reported NNTWG campaign data in DHIS2 just before, in fact, just after we sent this slide. So those are the kind of things we track, for in terms of implementation of the health sector recommendation. Also, there was a discussion recently, I think it was in March in Nasarawa, where there was an attempt to develop NIS guideline within the health sector to help address some of the HMIS data gap. We also participated briefly in that to see how that discussion also incorporates some of this recommendation. So for instance, in one of the surveys, the data platform we looked at for the health, there were 11 data platforms we looked at, which includes MNCH, the health facility survey. So during this period, also as an update, the health facility survey was released in the 2023 survey result was released, and I will just highlight one we had reported in the last subcommittee, 9KML, right? But one thing that was striking from that is that 21% of public health facility, only 21 accurately reported antenatal care data in HMIS in the past 3 months, based on the National Health Facility Survey. So that already shows us like there's a lot of gap in terms of this thing. That's like 1/5, right? So those are the types of updates we track regarding that. Also, some of our assessment findings is that there are implications for health even when you talk about other sectors. So for the sectoral programming itself, I've mentioned the health sector recommendation. Also, there is the NSPAN, which we are also gathered here to be reviewing and taking updates. So the health sector has a primary mandate to deliver on that. So in terms of data, how do we know if we are delivering on this strategic target and objective without a well-strengthened data system? And health is one example. Every other sector have also those policies where they are gathering, where they need to deliver on. Also, there is within different sectors, there are interdependent programs. Maybe the agri sector, I'm trying to look for example from agri and health, maybe issues around food safety, right? It may cut across multiple sectors. We have very clear examples also around school-based nutrition programs. So we heard in our assessment, for instance, that the schools are providing deworming for children and adolescents, and also they are providing iron folic acid supplementation. But the question is, where is the data? It's clearly not on the DHIS2 at this moment. Should it be on the DHIS2, or should it be in the National Education Management Information System, NEMIS? How does that data flow work together between both agencies? There are also implications. I remember when we did the state debriefing, was in Oyo State, where people were saying, oh, even Ministry of Environment have a role to play in maybe, I think, because they are supposed to look at public facilities, right? Everywhere food is being distributed, maybe abattoirs, canteens and all that. So they do also go to school to check school cooks, and they had claimed that they give them some certification, but then other people come and say, no, that's the Ministry of Health role to certify if they don't have underlying health issue. So you see Ministry of Environment also coming to play a role within that space. So but who is responsible for what? Because if we talk about multisectoral programming and we don't give a clear delineation, then it can be even like an architecture for chaos, right? If everybody's role is not clearly designated. So we have the large-scale food fortification, which a lot of information is going on, but it's industry data, but it's also nutrition. We need information of micronutrient deficiency. I don't know that there's LSFF data in DHIS2, or which should be, because it's compliance. Even though NAFDAC is an agency of the Federal Ministry of Health, we tend to group them with industry, and they're like, no, we are not industry, but we're like, we are working with industry. So how do we bring health, NAFDAC, SON to think about nutrition related data in that sector? So of course, there are also issues around multisectoral coordination bodies. So when we do quarterly meeting, this is a forum that is even in a way multisectoral, but there is a national Committee on Food and Nutrition where every sector is supposed to report. So when the health sector goes to such meetings, what are the core indicators? Because they will not go with their own DHIS to report, but what are the types of information that should be reported on a quarterly basis to NCFN? Like we were doing earlier this week on, is it Tuesday, when we had the technical working group for the development of the MFNDF, we said if your minister is going for National Council on Nutrition, what information, what data do you think it needs to present for your sector? If the Minister of Health needs to go to NCFN, what does it need? So if a health person is coming to NCFN, rather than just come to report activity, how does what you are reporting on a quarterly basis, how does it derive from NSPAN, and how does it help us to track progress in implementing NSPAN and makes budget and planning to see, health is really going on target based on what they are said rather than activity? So those are the kind of consideration. Of course, that's at the federal level. We have similar structure, SCFN, and now with the N774, we see efforts to strengthen the local government committees on food and nutrition. But again, that also needs to be well managed in terms of when N774 collect data, is it within the existing structure established for each of the sector? How does it go up? We're having a meeting with agri sector yesterday, and they are saying, maybe they will strengthen the HOD of agri at the LGA level. But if they have a data, who did they send it to? If they send it to the LGA chairman, is that not a political structure? Will it come to State Department of Agri and all that? So in all of this thing, there's a need, there are implications for the health, especially within the education sector. Those are the kind of things. So that's now, that's outside of the health. Even within health, there are implications for nutrition also. So for instance, the NSPAN has NCD, diet-related NCD goals, right? But we do know that those interventions are happening mostly in the Department of Public Health of the ministry. So when we engaged with them earlier this year, they were talking about, I think they were working with, is it University of Abuja or something, on the salt and sugar reduction study. Where does that data sit? Things around hypertension and diabetes, yes, maybe core, but it's also, there is nutritional, which of those is nutritional related. So, and I think those are the things, the food and drug also, we were told, also managing the issues of trans fats, which is also nutrition, just that is under NCD related. How does the nutrition department coordinate within this? So for the education sector, I think they are working mostly with, is it GASHE, right? The Gender, Adolescent, School Health and Elderly Care Division, more on many of these, their supplementation for adolescents and all of that. But how does the nutrition department establish linkages with all of these and, aggregate everything that is nutrition within the health sector? How do we encourage data sharing, or at least give a pointer, even if it's under the GASHE or food and drug within the years? How do we pull it out to form the nutrition? What have I done? Is this me or? Okay. So those are the kind of examples that. Okay, now I don't recognize my slides. Okay. Okay. So there are opportunities for, strengthening collaboration both inter-ministry and also within ministry. For instance, the school health and nutrition intervention that I mentioned, there's a clear need to strengthen collaboration on the issue of delivery of deworming and AFAS for adolescent girls. The ENSPAN objective that I mentioned, there's an objective that says promote and strengthen micronutrient deficiency measures to improve nutrition status of all Nigerians. And of course, deworming is part of the MNDC guidelines. So it's not clear if and how MOH monitors coverage of micronutrient supplementation within these school-based platforms. Of course, there are data from the food consumption and micronutrient survey that shows there's a gap in anemia. Deworming would solve some of that. IFA will solve some of that. Of course, most countries in Africa is not even making progress on anemia on the WHO target. But how do we, if this is an opportunity to reach that, how do we strengthen tracking progress in that area? And establish those collaboration. I also mentioned the food safety and environment, which is like an emerging area for multisectoral data coordination and use. There's a need to address food safety and environment as part of nutrition strategy. Of course, issues of hand washing, which of course water resource and sanitation ministry also play a key role in providing wash facilities in schools and all of that. So they have a wash management information system that also have data that may be implied for nutrition. So, but it's not clear where these data are captured and used, especially the food safety data, even though there's a national policy on food safety and quality, which is also domiciled within the ministry. And so, and what the Kebbi and Oyo states, some of their requests is around providing guidance for domesticating this national food safety policy, because they feel like if there's guidance, because at the federal level there's role of, oh, this person does this. If there's guidance at the state level, everybody will know their role. Nobody will say, because it was, I needed an element in that meeting, because it's like the next time you come to school, anything you see, you face it. You are not supposed to come to our schools. It's not your mandate, how these things run. So, but if there's a guidance document that says, this person has a role in this, then it's more easy to manage and also to avoid some of this. So, to the outcome of what we are working on. So the idea is to, have a document that is pretty similar to the health sector one, and that now include other sectors. So for the health sector component of that, since we are because for the document, in addition to the full main body of the document, we are developing sector briefs that each sector can pull out and know that this is our own data activity and data structure. So for the health sector part of that, we are planning to just make reference to the recommendation that exists, and also now all of this issue, how do we update it and now include that, oh, there's an already existing document, but since 2022 till date, this and this has happened. Also the assessment findings is, how do we, what do we include in that multisectoral document for health, is why we're also bringing it to this stakeholder group and all that. So, like I mentioned, the Federal Ministry of Budgets and Economic Planning is the ministry we've been working closely with for this multisectoral nutrition data assessment. And just on Wednesday, is it? Yes, we had the third technical working group meeting with this stakeholder. So we brought nutrition desk officers and also PRS representative from key sectors, including social protection, education, agri, even health was there, and all the people contributing to nutrition. And yes, so thank you. That's what we wanted to share, and also to be able to get in. Thank you.
Thank you. Thank you very much, Dr. Folake and the DataDENT. We need more, please. Thank you. Thank you very much. Thank you. So I think this is quite insightful, and I'm sure we may have one or two comments or questions to make before I come back to this side. It's quite interesting to see that the DataDENT is now building on the work that was done that was specific to health sector. One thing from me is like, as you're tracking the implementation of the recommendations, whether you have any advocacy system in place to be sure that the recommendations have been implemented, so that you'll be sure as you track, maybe implementation will be better. Rather than just we have given you the recommendations, as the way the system works, you can drop all the recommendations in the world and they can just be on the shelf. So that's just one thing from me, but there are a lot that can be said from this presentation. For the sake of time, I will take 2 questions or comments. Already recognized Kingsley from the right-hand side. Any other person? For Dr. Apolami? Okay, so your hand is up? Okay. So you are the host. So we'll come back to you after here. Okay, so I have 1 from Kingsley, 2 Dr. Apolami, and 3
there's a hand there.
And 3 Mrs. Gabriel, and 4 that's number 4.
Yeah.
So we have 4, and we'll take those 4 and then go back to the director NIS for his comment. Kingsley, please go ahead.
All right. Thank you very much for the wonderful presentation, and I can see it's very much very, very encompassing. But I want to ask, is the scope of your work, do you have any scope of work around nutrition commodities, maybe data on nutrition commodities, or is it outside the scope of your work? Because for nutrition program to be very effective, effective management of the commodities is key. And we have issue of commodity diversion, which has been a very serious issue for nutrition programs across the country. And we are looking forward to how do we address this so that whatever commodities we have in place can reach the targeted population, and then the data that comes up can also help in good planning. Thank you.
Thank you. May we go to the second person, Dr. Apollo.
Thank you very much, Dr. Anjari, for the beautiful presentation. It's very nice to hear and know about the work of DataDENT. And we know that data is something that is particularly important for Nigeria because we need to measure all these indicators. What we do not measure, we are most likely not going to see. And yeah, that takes me to the important question of data harmonization. If we look at what we've been doing with regards to national data in the past few years, we've made some progress. We've, in the past couple of years, we've had different dashboards measuring different indicators of nutrition, and we have a lot of that right now. We are at a phase in which we have to be thinking very actively about harmonization of our data. The FMOH SW is doing a lot. We have the standard DHIS2. We have the MSDAT. On the MSDAT, we even have now new indicators specific for nutrition. Now the question is harmonization. Do we have an active plan about ways to harmonize our data? All this data from different sources, bringing them together, putting them in forms that are usable by millions of researchers in Nigeria, where they can even discover new insights apart from just prevalences and progresses and trends, where they can develop new insights from our data, because we assume that those data have been collected rigorously and they are accurate. So we need.
Thank you, Dr. Apolami. Sorry, I don't want to be cutting people.
No, I'm done.
For the sake of time.
Thank you.
We should be going straight to the point if we're asking questions, please. Okay. Thank you, Dr. Apolami. We'll take the floor, then you respond to it. Okay. Straight also. No additional presentation. Okay, so Mrs. Gabriel, please.
Thank you so much, Dr. Folake. In your presentation, you mentioned the choice of Kebbi State for the north and Oyo for the south. Was the selection random, or were there other criteria used? Thank you.
Thank you. Dr. Bolale, please, before SNO Ekiti.
Okay, thank you. So you mentioned that schools provide deworming services. So my whole question is, how do we get this data into the NHMIS dashboard?
Thank you very much. We have 4. Do you have any online participants, please? Sorry, we didn't check earlier in the morning. Do you have any online? Media, please. Any online? Okay. As they are checking, please, can you? Okay. Yeah, I can see we have many online today.
Yes, we are here, Miss.
Okay.
We are here, Vice Chairman.
Okay, so thank you. We'll come back to you after this set
morning,
of response.
we are here.
Oh, sorry. So sorry that we have forgotten to recognize the online screen. Good morning. I can see the boss. Okay, I can see hands there. So we'll give you a chance after this.
In fact, our hands are up. Yes.
Please, we'll come back to it. Keep your hand up, but don't be tired. We'll be back to you in like 3 minutes after this response, and take the online participants, please. We are about getting to our tea break. We don't want it to be too cold. So be quick on this, please, so that we will be able to move forward. So after these 4 responses, we'll go to online and pick the 2 that we have, and then we'll come back to the floor. Thank you. Over.
Okay, thank you. I'm glad my technical advisor is here, so if I can't answer, I'm not scared. She will bail me out. Okay, for the first question, nutrition commodity tracking. So the health sector recommendation has like a full session that discusses National Health Management Logistic Information System, right? Is that it? Yeah, because like I mentioned, we looked at 11 data platforms. I hope I can remember them. So there was for the administrative, it was the the Health Logistic Information System, MNCHW. What was it again? The DHIS2. How am I forgetting it? Then the survey was the Health Facility Survey. It was the NDHS mix. Yeah, it's not very fresh in my head this morning. I used to be able to recall it clearly. So there's a full session on that in that document, and I think some of those have also gone into discussion when they are discussing all the nutrition commodity unbundling and all of that into the this. And there was a meeting recently that talked about adoption of some things into the what's that thing called again? The health. There was a meeting. Sorry, I'm losing information this morning. What was that meeting? Health commodity something. Yeah, something like that. Yeah. So that's for that one. So there's already a comprehensive description in the health sector one for that. So except there are missing information or newer information that needs to be updated, then we take account of that and reflect it in the multi-sectoral one. Regarding data harmonization and national listing, yes, there are a lot of dashboard, and I always jokingly say, just that there's dash in the board, right? So we have the food system dashboard, we have the national nutrition dashboard, a lot of dashboard are coming up. And one thing that the national nutrition dashboard, domiciled in the Federal Ministry of Budgets and Economic Planning, has done is to try to I think you can access it online, link some of these. I know they've already linked the food system dashboard on it, and they have also some reports. Even this health sector recommendation, I think, is already on it. They have some of the nutrition reports on it, so that it's intended to be like a one-stop shop for it. But when we talk about data harmonization, it's a conversation we're having. Like, I don't think we'll get to a point where everybody will say, let's put all our data together in one basket. It will be, let's agree on what is minimum to report on a central platform, because even when you attend NHMIS meeting within health alone, nutrition is still struggling to even put some things. And if you sit with some mother, they say, but you have counseling under postnatal care. Why are you counseling again? I say, but the mother needs to be counseled, along the line. But I mean, is it not breastfeeding? Why, So even that they are trying to, so you can't take all of that to a multi-sectoral. So it has to be what's minimum for health to take to a multi-sectoral platform. What's minimum for WASH? So for instance, in WASH, they have indicators that it may not stare you in the face as a nutrition
Dr.
indicator.
Anjorin.
Yeah. Okay. So that's this question is there's a national nutrition dashboard that has intended to do that. Whether or not you can now link other to it is a whole lot of discussion around interoperability of platforms and all those data things that I don't want to go to. For the choice of Kebbi and Oyo State, it was not random, it was purposeful, and we had used 6 criteria because we wanted to assess multisectoral nutrition program. It was important as a minimum that there were already multisectoral programs in those states. There were partners supporting, there were MDAs that had funding that were already doing that. Yes, it was 6 criteria like that, and it was based on that. Active SCFN, because that will be where they are discussing multisectoral platform. How do we put school data in the NNTWG? Well, that's why we brought that into this meeting, because it's what the stakeholder need to. Thank you.
Thank you. Thank you for the responses. We'll just take the 2 hands on the online platform, and then we come back to this side. We recognize the presence of our colleagues and boss. Can recognize Pauline Ada, hands up, and Dr. James Oloede. The 2 of them were with us yesterday, and thank you for sustaining the momentum. Peter also was with us from Action Against Hunger yesterday, and is still here now online. I can see Charles Nkola, who has been with us yesterday online. Dr. Francis, you are welcome, and Mariam Bahari Shehu from Dangote Foundation. Thank you. We have been looking for you yesterday. It's good that we are seeing you here today. And Zainab was with us yesterday, and Susan Olubajo, all of you are very much recognized. Winfred. On this note, we want to take Dr. James Oloede's question. Please straight to the question. Over.
Thank you very much. I recognize all the officials on the table and distinguished colleagues. The question is also a comment quickly. The nutrition dashboard that domicile in the Ministry of Budget and Economic Planning, I want to believe, or let me just put as a question, whether all the sectors that were on National Committee on Food and Nutrition, a dashboard for nutrition, are already linked. And if they are not linked, I think the best way to go is to see that members of that committee at national level that domicile in the planning, should have their dashboard linked to the national nutrition dashboard at domicile in the place, so that it can serve the purpose of one-stop shop. Once you click it, you want to look for information on WASH, information on agri, you can easily find it on national dashboard. Then number 2, I agree that it's very difficult to have to harmonize all data that comes on nutrition because of multisectoral nature of nutrition. But I also want to suggest, if there is or if there's not before, there's a need to have a compendium of standard nutrition in Nigeria. We need to define nutrition indicators and saying that from what the nutrition sector will be evaluated or assessing the same situation based on the standard indicator that Nigeria agreed to. So those are the 2 comments I want to make. And finally, the N774 situation. I believe that we need to strengthen the local government committee on food and nutrition. The example Dr. Falaka made about agri, each of these sectors are member of the local government committee on food and nutrition, and it's expected that in each of their meetings, their submission, are reported back to their parent sectors, okay? And these are communicated to the states from where they can be linked to various dashboards that we have. Thank you very much. Over.
Thank you, Dr. Oloede. two questions and one comment. So the first question will be handled by the director from the Federal Ministry of Budget and Economic Planning. Then the second one by DataDENT. And the last one was a comment. Thank you. Pauline, please. Pauline Ada, straight to the question, please.
Thank you very much. I think Dr. Oloyede has mentioned one of the questions, which is about link. And my question is actually in relation to the challenges and timeline where we can see these results or data online. And immediately I tried to go through the website of DataDENT, and I would also like to ask how efficient are these data uploaded, and how efficient are the nutrition data also accessible, because sometimes we need this data and we go search and they are not updated. What are we also supporting the government to do to ensure that these data are timely and accessible? Thank you.
Thank you very much, Pauline. May I invite information services, please, to say a comment or question before we come back here and wrap it up? Or do you want her to respond to these two before you come? Okay, she can respond. Okay, so go ahead and respond to these two, and then we'll come back to. Thank you.
So, okay. Hello. Hi. Hello. Okay, you can hear me. Oh, okay. Okay. Thank you. All right. Thank you very much. So I guess I'm responding to the one on compendium of standard indicator, while Director FMBP reports to whether the other sectors are already linked. So for that, what I can say is that part of development of the multisectoral food and nutrition data framework that we are doing, like I mentioned earlier, we are developing sector briefs based on what we heard about the activities they are doing, their review of policy. We've been able to tease out, oh, okay, you are doing this activity, these are the indicators your policy says, these are the things. So we are working with the sectors to say, which of these genuinely do you actively follow? We're also using like a standard framework, the conceptual framework, to say, what should agri contribute to nutrition? This thing, but we don't also want to be theoretical and give people a shopping list of indicators when they are not doing activities in that area, because it will just be there and there's no this thing. And also, if we recommend do this indicator and there are no data sources to be reporting it, the indicator is just there, but maybe the survey, let's say the survey comes out every 5 years and you said you want to be tracking it quarterly. It's dead on arrival. So those are the kind of consideration why, those are the things we take to the technical working group to try to present to people to say, hey, guys, what's really going on? The second one, I am not quite sure now. The timeline to see results. Okay, the last speaker was saying this. Well, on DataDENT, you will not see Nigeria data. The best you can see is maybe blogs on our assessment process and how we're engaging with stakeholders, because every other data will be on the different platform. But what DataDENT website can just show you is maybe some of the platforms we have identified. Like I mentioned, if you talk about dashboard, we have the Nigerian Governors Forum scorecard. Those are like, we've classified those as accountability tools, right? Because you are just seeing like a visual, just something that makes it easier maybe for a governor or for people to see. But there's a back-end database somewhere that you need to access that is even generating that. So for that, there are different stakeholders. So at best, what we can present is this stakeholder. If you need this information, you can see it on MFI index, or if it's private sector, if you need this information, you can see it in Ministry of Health. Then it's then up to whether or not each of these sectors provide that. In terms of how timely are data, again, I think health has fairly advanced administrative data. So for the sectors we've assessed, health has a system as DHIS to wash as washing. Some sectors don't even have information management system at all. We are still even trying to see how is data flowing. Let's even start with what activities do you do? How is data do? There's even, we found from the assessment, there's even a gap in understanding of multisectoral program, because people are saying, give us indicator, and we're like, we can't give you indicator. You tell us what you are doing. We could sit down together and frame indicators based on what you are doing, because the wind is blowing, like I always say. How do you know when the wind is blowing? Who knows?
Thank you.
You can see trees are bending. Maybe there's gathering. So those are how do you know if your fuel is finished? Hopefully your fuel gauge is working.
Thank you very much, Dr. Anjori. We go to the head of and director of Nutrition Information Systems, please, for his comments. Thank you. Okay. Yeah. Can you?
I hope it doesn't. Thank you very much. No, Chairman, you hold my own. Yeah, thank you very much, the Chairman, and thank you, DataDENT. Yes, it's very interesting to hear about data, and that's the main thing. But we want to agree here. You can't build a house without a good foundation. You will continue to repair the house throughout, and you may end up losing the house. That's where data belongs. You need a strong foundation for you to have a good data. Before we go into multisectoral challenges, we talk about sectoral challenges. Even within the health sector, there are issues, and that is why the departments are well organized. There's a coordination within the health sector, and we know where to get who does what. And that's why there's always a guideline. And for me, we are having challenges in multisectoral. This is a teaching problem that arise when you have a multisectoral. For anybody who has been in HIV program, I think that's the first experience we would use to understand how multisectoral works. I used to tell people, when the chips are down, we know where to go back to. We have not defined the roles and responsibilities of each of the sectors in the multisectoral. The coordination framework has not really defined roles and responsibilities of each of the sectors. And why do we have multisectoral? We have multisectoral to ensure that each sector works in their area of comparative advantages to avoid conflicts of interest. We have limited resources. We need to put resources where they are required. But right now, it's like we are still learning. Everybody is doing everybody's job. Among the health sectors, we know who is doing what, and we know who is picking which data. And when we need the data, we know how to get them. And that should be the same way in multisectoral. I recall at the early phase, all the ministries, everybody wants to do ART. Everybody wants to do HIV counseling and testing. Everybody wants to do OVC. But at that point, we discovered that this is wasting of resources and time, and we begin to define and put restriction to what people will do. Until we come to that in nutrition with data, we can never harmonize data. There is no way you can harmonize a data when you have not defined, because data comes from program harmonization. If we have not harmonized the program, we cannot harmonize data. So the first point, getting data right, is harmonizing sectors. What should you do and what should you not do? For us in Ministry of Health, in Nutrition Department, we know where we are working. We have moved beyond where people think, and very soon, I think Director will make presentation on that. Maybe in the next quarter, she will be presenting reports on where we are. We know where we are supposed to limit our responsibilities. And I hope other sectors will also learn to limit their responsibilities. Data should flow, and we know what we're supposed to give to the coordinating body. It's not everything that comes out that goes in. Even in the DHIS, on the DHIS is not supposed to take all the indicators. That's why you have HIV program, keeping multiple of indicators, TB keeping. But when we get to a point, we know what to submit. So that's what I want to leave here. Thank you very much.
For the Federal Minister of Health, Dr. Abacha, can take the whole day talking to us about this subject. Thank you very much, sir. We appreciate your comments.
Thank you, Prof.
And I'm sure there will be room for more engagement to get it clearer and clearer on how best we harmonize and move forward with data issues.
Thank you,
Thank you very much. Can we appreciate Director, please? So we are aiming to go for our tea by 11, a few minutes away, but now hand to the directors here. First from Budget and Planning to respond to the question that is directed to the budget, and also make general comment on the presentation. And then we'll come back to wrap up with the Director of Nutrition to make her comments on this. Thank you. Over.
Thank
you. 1 minute, please.
Yeah, the chair, the director, I observe the protocols. I am really delighted that Mr. Bata had spoken. And then I remember one of the things that I can take back when the current health information system registers were being developed. Then when he was still in health planning, research and study, he said that nutrition is the only program in Nigeria that has no data. In fact, that made me to begin to think truly, what can we do? That was when I was in FCT. So having heard all that he has said, truly, in this new policy that is being revised, one of the key things that we have all agreed to do is to ensure that we put in roles and responsibilities of the different MDAs to be clear in the policy. And also, going further on the data, the aim of the Nutrition Data Alliance, the Multisectoral Nutrition Data Alliance, is for us to have a compendium of data that will be reported from all the multi-sectors, not everything. The key that each MDA would really want them to be measured by. That's just the key. And then coming to the question on whether we have some of the data from the MDAs, other MDAs already integrated in the National Nutrition Dashboard. Yes. I gave the media team the link to project so that you can see it. And then it's still work in progress, I would say. But to some extent, we've made some progress. The food system dashboard is already linked, and then also the performance management system, the PMS, is also linked. And the PMS is the tool that all the MDAs use in reporting when they come for the quarterly meeting. So moving forward to that, it's now for us to clearly, through this work that Folake has just reported, for the MDAs to have the data sets that they should be reporting regularly during the NCFN. And we'll be seeing it all there on the dashboard. Thank you.
Thank you very much, Director. We go to Nutrition Department, Federal Minister of Health.
Okay. Thank you very much, Chair. Obviously, I'm the one standing between us and our tea. So I'll try not to keep us too long. I'll join others to appreciate Dr. Anjorin, DataDENT's, for the presentation. You all agree with me that effective decision making rely heavily on timely and appropriate data. So for us in nutrition sector, and I say nutrition sector, I did not say in health nutrition sector. For us in nutrition sector, data is very, very key. And we have paucity of data. But if we review what we have done within the past 2 years in terms of the paucity of data, I think we have moved forward. Please, let's appreciate ourselves. We are not stagnant, but we have not reached the promised land. And that was what made us to have that 10th commitment, which we made at the N4G. The 10th commitment says we are going to ensure all sectorial platforms are operational and linked to the National Nutrition Dashboard. So even those sectors that do not have active data management system in place, we believe that within the next 4 years, they will have that. And my sister DataDENT's, in your presentation, you talked about what is practicable. I'm representing government. What government wants is what are we expected to measure so that we can reach the promised land. And the promised land is ensuring food and nutrition security. Practicability, we have no option, because if we are not monitoring, why are we not monitoring? What are the challenges? What do we need to do so that we monitor the prioritized indicator? Not, how do I put it? We're not looking at something that is convenient. No. What is it that we need to measure per sector? No matter how hard the rock is, let us have it. And we will find a way to make sure that we deliver that indicator. Because right now, the visibility, the attention, the prioritization of nutrition, it's no longer a sectorial thing. It is a presidential thing. So, and we have been directed by His Excellency the Vice President that we should let the government know what decision to take. And knowing that we are speaking with the political class, so you don't just say we need to do this. Also, as technical, we need to tell them how, what we need. If we need even external force, external support, we put it down clearly. And we have gotten the commitment that we will get it, the support. Not just at the national, even at the federal, through N774. The governors are now, committing to supporting nutrition. Abia, was the first state we went to through N774. And immediately, the governors, we went through the scorecard from the Nigerian Governors Forum. We sat down with his cabinet. We went through everything. And there and then, he started giving out some directives. Same thing was repeated in Plateau and other states. So please, no more politics when it comes to nutrition issue. We should not overblow issue. No. Exactly what the situation is. Let's bring it to the table. And what are the local solutions? It's a good thing what happened with us and the US government. A lot of us in the government cycle, we applaud it because it has made us to now look inward. And there are a lot of resources. When I say resources, I'm not just talking about money. I'm talking about money, I'm talking about human, I'm talking about material. There are a lot locally. So I want to once again say thank you to DataDENT's and assure you that we will do the needful. I think what you are trying to recall is the Nigerian Health Logistics Management Information System. Thank you.
Thank you very much, directors. I think we can also appreciate ourselves because we have now had our tea break. I know this conversation will continue on and on. We're hoping that DataDENT team is still around and we can interact with them as much as we want.